Good evening. I'm Charlene. I don't come from a clinical background like Michelle. My work was always in administration. And now I've been in this unit for the past 10, 12 years. So basically, I lead a team of 9 people who work here at Maltese and another 2 who work in London. Our unit basically deals with various areas. Mainly, it's the patients who travel to England under the bilateral agreement, as Michelle stated before. And although it's been set up in 1975, the first case that traveled to England was actually in the 1948. It was a cancer patient, and that's basically since when this unit has been functioning. In fact, the agreement with the nuns that we currently have, it's been there since the 1960s. Something that I've learned very recently myself as well. We also manage the patients who are referred under the S2 route, which is basically in centers within the EU, outside the UK bilateral agreement, and also the patients who travel to Palermo, the ISMET center, where our patients have their lung transplants. It's quite recent compared to the bilateral, but ISMET has been supporting us for quite a few years now, and as time went on, they've also started supporting us on other transplants. They take our urgent cases for liver transplants, and they've also started supporting us with cardiac cases. Recently, in fact, they have transplanted 2 cardiac patients. Since last year, another member joined my team and deals with the ERNs. The ERNs basically are European Reference Network Centers. The first 24 ERNs were launched in 2017, and they involve 90 highly specialized units from over 300 hospitals in 26 member states. For the ERNs, the patients do not travel. Basically, the consultant caring for the patient submits the case. It's discussed online between various hospitals and areas of expertise, and they come up with a solution so the consultant can treat the patient locally. My unit also deals with foreign specialists who visit Mater Dei regularly. We have around 90 visits a year from different specialties. They basically come over to Mater Dei to do clinics and surgeries. We try to increase as much as possible these visits to avoid the patients from going through the trouble traveling abroad. The Treatment Abroad Committee, so as Michelle said, all referrals go through the Treatment Abroad Committee, whether it's a referral under the bilateral S2 cross-border that Dr. Gatt will eventually be explaining. Also, the ERNs all go through the Treatment Abroad Committee. It's appointed by the minister, and it is composed of the chairman, 12 members, one of which is a lay person that represents the public. The others are all consultants from various areas within Mater Dei, and the secretary. The cases are circulated. Usually the committee used to meet, before the committee used to meet every month. The cases were reviewed and decided. But to avoid the wait for someone waiting for his approval a whole month, we've started circulating the information by email twice a week. That way, the process is much faster. The patients wait less, appointments are obtained earlier, and it's proven to be more efficient. When there are difficult cases, the committee meets, and other members of staff are invited to provide more information so that a proper decision is taken. The committee also provides clinical recommendation to the ministry for the introduction of new services, usually through visiting consultants. So what happens after the committee decides? So the committee decides to either approve, which is straightforward, so the consultants and the patients are informed about the decision, or takes a decision to put a case on hold until further information is obtained, or decides not to approve. The committee never says no and stops there. The committee says no, but offers a different option, a different route. In that case, the consultant is informed and he communicates with patients to follow the path that is being proposed, basically. The committee decides on cases based on whether the treatment that is being suggested is clinically proven. No trials are approved. Whether the patient has exhausted all the options here in Malta, and whether all the other areas have been consulted, basically. So once the patients have been approved, the team from the Treatment Abroad unit contacts the patients. They explain their entitlement in terms of what is free and what they need to cover, and what services are available. The government covers the flights for all the patients, plus, if you are under 18, even the flights of 2 accompanying relatives or friends, whatever. The accommodation for the patient, the subsistence, which is the meals. We provide the transport in London or wherever you are traveling. And if you need special arrangements, say you need a stretcher, you need an air ambulance, you need oxygen, that's also organized from our end, and it is also covered by the government. It would be impossible for the patient to cover. An air ambulance costs the government around 40,000 euros. So imagine you have to, if you're lumped with that cost. Apart from us, there are also the charities who support the families. So Malta Community Trust Fund basically covers the cost of a relative, where we don't cover. Malta Community Trust Fund most of the times covers the cost. Puttino Cares, the government has an agreement with them, whereby the government pays for the patient's accommodation, but the relatives stay for free. Puttino offers the accommodation for free. Since last November, Carl Vella Foundation has launched a new service. They have identified a gap that they very kindly offered to cover. They offer psychological support to the relatives and the patient who are going through the treatment abroad. So what happens once the patient is abroad? We inform the embassies. We only have the setup of proper support actually in England. We only inform the embassies in Italy and Germany or wherever they're going, just to let them know there are Maltese citizens receiving treatment in their country, and if anything happens, they support. But in England, we have a full system. We have 2 dedicated people who are 24/7 on call available to support the patients. They coordinate their transport, they assist them with medicines, they assist them with appointments, they support them in emergencies. Apart from that, we have a contract with the Franciscan friars, and 2 friars are employed with us and provide spiritual support, emotional support, and basically they help the patients with every nitty-gritty that they need. So the number of patients, unfortunately, increases every year. Although we invest and improve the services here and increase the services here, the numbers of patients keep increasing. And this basically because of the new medicines, new services, and which give our Maltese nationals the opportunity to access the latest treatment. The numbers here actually are not as high as they were pre-COVID, because it took England quite a few months to recuperate from COVID. We still kept sending patients during the lockdown. It was very difficult, but we managed. And the very urgent cases received the treatment and the support that they were receiving pre-COVID. 2022, the cases have started going up again because England has started issuing appointments from start. Last year, we had to work out in emergency to send 21 patients to Rome because of for radiotherapy when there was the problem with the equipment here in Malta Day. And the 26 patients are basically patients that access treatment in the European Union and in Palermo. And last year, we coordinated 79 visits by foreign specialists. The government budgets around 5 million a year for this service, because although the bilateral agreement affords us 180 quota numbers, as you saw from the numbers, we exceed that number with quite a lot of number of patients. So anything beyond the 180, the government has to pay. They allocate 5 million, which is never enough, but understanding the sensitivity of the cases, the budget is always topped up so that everybody is covered for the treatment. Those are our contacts and the people working within the unit. Basically, that's it. So, okay.